Hello, my name is Brent Everhart. I'm the Maternal and Child Health Program Manager at the Butler County General Health District.
And I'm Teresa Brown, the Queens Village Program Specialist at the Butler County General Health District.
And today we're going to have a short conversation with you about how we build power through connection with Queens Village. So, as many of you know and have heard many times, Queens Village is a supportive community for Black women who come together to rest, relax, and repower, and ultimately take care of ourselves. We want to create a space that's grounded in sisterhood, health, wellness, and advocacy so we can support each other. And we serve Black women in Butler County through community connection and equity.
Queens Village has three pillars that um, we go by. The first one is relax, rest, repower. Reduce Black women's stress by creating spaces for them to relax, rest, and repower. We also have changed the narrative. We changed the narrative by we changed the narrative about Black women by creating spaces and content for and by Black women that celebrates and amplifies their voices. Engage the community. We engage the community. We engage the community with social, political, medical communities and support equity initiatives and reduce implicit biases that affect Black women.
So throughout the presentation, you'll hear me talk a lot about the pictures. With the work that we do in changing the narrative or just creating the images for Black women, we always want to take time to take pictures that also empower and repower us. So this photo here in the left corner is one of our community advisory board's daughters. And she comes to everything. She is a very happy party to hop in and help. But it's also an importance to see our children around us watching us grow and rest and create those spaces that ultimately bring us relaxation. So I'm going to highlight a lot of pictures that you'll see today.
Today, our focus pillar is going to be engage with communities. We engage with social, political, medical communities to support equity initiatives and reduce implicit biases that affect our Black women. Our goal, strengthen the connection between Black women and their infants in Butler County and the systems that serve them.
This bottom left photo is a bunch of pictures that we took at from our vision boarding event of some of our village members. And the bottom right photo is of Amanda Hayes. She is a big ally at the health district who works with us in many spaces. She works in our nursing department. She comes and helps facilitate with Kristen some Stop the Bleeds. She has come and done blood pressure checks at events. She's just been a really big ally. So we always in our work as well. So that is why Amanda Hayes is pictured on the bottom right. So how do we do this work in Butler County? One of the big ways that we do it is we collaborate with Medicaid, which is Partners to Reduce Infant Mortality. And that is a grant that is housed at the Butler County Educational Service Center that has community health workers in the community, and it creates a space where we're able to have direct contact with many families through our community health workers. And when we have that contact, we use their voices to uplift the work at the health district, whether it be through the Community Health Improvement Plan, which is a plan that is implemented across the county with the two local Middletown and Hamilton health departments, or it's the Butler County Infant Vitality Commission, which is co-led by myself and Brittany McGinnis, who leads the priority service area for the Community Health Improvement Plan, or at the Health District with our Maternal Infant Vitality Initiative grant. And we take all of the feedback that we hear in the community, whether it be from our home visiting families, women at our events, and we take that feedback back to our health systems so that we're able to build better networks and better connections to services, and just give that overall feedback that may be lacking in some of our data numbers that we get, that quantitative and qualitative data back into the community. This bottom left picture here is Brittany McGinnis, who is the PRIM, Partners to Reduce Infant Mortality Supervisor at the ESC, where they house community health workers, doulas, and lactation work. And on the right here, I thought that this was a nice picture to involve because it shows how the work here at the health district goes further and how by connecting with people who are in, whether it be public health or legislation, we're able to pass policies and legislation. So the first person pictured here is Dr. Birch. Um, the second person pictured here is District 9 Senator Catherine Ingram, District 11 Senator Paula Hicks Hudson, and myself. We attended the Black Maternal Health Caucus Summit during Black Maternal Health Week this past year. We were able to listen to Winty from Department of Children and Youth and Meredith Shockley Smith from Cradle Cincinnati, who was the originator of Queens Village, and Jill Miller speak on their book they have on infant mortality and other wicked problems. So it's a lot of great communication and collaboration that happens in many spaces. So one of the biggest things that we're going to highlight in this presentation is our allyship walks that we recently hosted. Allyship walks hosts build solidarity and connection within our community. It's a great but simple way to be able to bring the voices in listening sessions and shared movement of the work. So bringing our allies together, we were able to shine a light on Black maternal health equity. We were able to connect and unite our communities and share the message in Queens Village and why Black women and community members, we should honor the work and the words through truth and unity. So being able to bring our village together and community members, we were able to walk around Smith Park and able to host an educational session where they learned about our pillars and how we operate in Butler County. Partnering with Medicaid. I said this in the previous slide about Partners to Reduce Infant Mortality, but we also have a new relationship that has formed with Anthem Medicaid. With the ESC's agency with Partners to Reduce Infant Mortality, we host community baby showers, which is where this lovely picture is from down here. And the collaboration with PRIM is very strong. It creates a space where we're able to educate and connect with families, but also to celebrate new experiences that Black mothers have and our community health workers. And having the community health workers be able to be like very grassroots and on the ground and in these homes creates a space where we're able to share that education and that support throughout the entire county. And the new partnership with Anthem, we've been able to host breastfeeding support groups. We've also been able to host healthy eating classes where we bring in the Ohio OSU Extension to teach us about healthy eating, what it looks like to prepare a healthy meal, what goes into it nutritionally, and just a better way to understand ways to take care of our body by what we eat. So this next slide I wanted to highlight, in our work, we do a lot of work with our village, and it's very important to highlight the voices, photos, and experiences of them. Angie Prishia Sansa, she came through many of our community health worker programs. She had a community health worker herself. She went through many of the programs that help keep you on track for your child's developmental milestones, along with working with her to make sure that she meets any milestones that she would like. And Francine Kawanu, who is a program specialist at the health district, talked with her and connected with her to get her to become a community health worker herself. So it was a great opportunity to be able to see a mom who we met in the community through community health worker services, who has a great connection with the work, to watch her take steps in her life with the people who surrounded her to become certified through the Ohio Board of Nursing as a community health worker. And she also is now a new Queens Village Community Advisory Board member, which I know will spark inspiration and give her a space to share her story, as motivation to other women in the community to know that if you have goals, you can achieve them. And being a part of Queens Village can help you take steps to achieving your goals in any way that you see. So elevating Black women's voices. We talk a lot about the spaces that we use the voices of Black women. We talk about them at the Butler County General Health District in our surveys that we take, the work that we do to service community members. We use their voices to inform our work. The Butler County Infant Vitality Commission, which is co-led by myself and a village member, is a space where we bring many health professionals and community members together to talk about the work that's happening. And the Community Health Improvement Plan is the plan put together by the entire county, of health professionals, whether it be Middletown, Hamilton, or other cities in the county, to be able to create a plan that helps bring better health outcomes to people in the community, and Black women and their families. And it drives the local maternal health initiatives. Everything that we do is based off of feedback that a village member said, or words that we are hearing, or data trends that our epidemiologist Leah is able to show us. There are many things that we're able to pull from to create a well-rounded plan to be able to encompass everything.
As Brand just said, elevating Black women's voices. So, with that being said, we do collect community feedback, and the community input shapes the CHIP priorities and the Butler County General Health District programming. And this is just a few um, feedbacks we received from some of our village members. Queens Village creates a space where I can be myself and just relax, and it's empowering. I have appreciated the opportunities to connect and relax while also being motivated to get moving. This has been a difficult month for me, but I have looked forward to these experiences. They always have events you can look forward to. Just a few feedbacks that we've received from some of our events.
So again, speaking of the photos, this is one of our village members who came to our very first Rural Stride Step series. And when I tell y'all, she literally walked into her pregnancy. She walked the entire month with us when we met up. And the next time we were supposed to have met, she had her baby.
Yes.
So it was an amazing opportunity to be able to bring movement and understanding that throughout her pregnancy, movement can help with your health along with the baby's health. This is one of our community advisory board members' children who came to our Queen's Giving, where we had women design bags, and they ultimately designed a bag and they could fill it with goodies to gift to someone as passing on forward and thanks. This is a photo of some of the that's actually a community advisory board member now, who brought her children to our spring fling event where we talked about grief and loss, and we painted flowers and we potted flowers to be able to say what we wanted to spring forward to. And this is myself and a village member who came to our vision boarding event, and where we created a space for women to be more intentional about their goals for 2025 and where they wanted to see them at, to put them on paper to be able to visualize them. So why the equity lens matters? It matters to Queens Village, but it also matters to the Butler County General Health District. And at the Health District, our mission is to prevent disease and injury, promote health and wellness, and protect the environment and achieve health equity. And we do that by tackling the social determinants of health for our Black women. We have Trina Flowers, who's our program specialist at the Health District, who works with the BCRTA to provide transportation to women to medical appointments. We reduce implicit biases in the systems by hosting educational sessions, and having spaces where we can have some of those more difficult conversations, but have them constructively. And all of these things that we do support maternal and Black infant health outcomes for our community.
So, with that being said, the question is, how can you get involved? Attend our All Out walks, share our mission, learn how to support Center Black Women's Voices in your work.
So the photo that you see here on the left is one of our village members' sons who came to our Black Girl Play Day. And even though our event is Black Girl Play Day, it's crucial to know that the entire family nucleus of father, son, daughter, husband, wife, or just couple is important to the growth and thrive for our communities to be able to thrive. Having everybody know that they're involved, whether it be in pregnancy, whether it be in the postpartum care of a mom, or just in the way a family operates in general, knowing that each part of the family is important and should feel poured into is empowering, but also something that I think needs to be said in many spaces so that everyone feels that they are just as important. So if you know me, you know it wouldn't be a Queens Village PowerPoint without a video. So recently we hosted our allyship walk that we spoke about earlier, and we wanted to end the video with a short video to show you about our allyship walk, give you some data points, and just let you into what our last allyship walk was. Hey Queens, if you know we're walking, we're out here at Smith Park, and we are hosting an allyship walk with our community partners and community agencies so that they can learn more about the work Queens Village does and how we impact infant mortality right here in Butler County. So hopefully we're having a few special guests, some local Middletown people that people may recognize. So we're excited to host this allyship walk and come along with us as we learn about our impact and our journey with Butler County. Queens Village is a supportive community of powerful Black women who come together to relax, repower, and take care of themselves and each other. At the heart of our work are three pillars: rest, relax, repower, change the narrative, and engage with community. And none of this happens here today. Our goal is simple but urgent: reduce infant mortality in Butler County and create healthier outcomes for all Black families. Infant mortality is defined as the death of a baby before their first birthday, and is measured per 1,000 live births, and it remains one of the most important indicators of the community's overall health. And we're making progress. Since 2023, we've seen some real movement. Small steps matter, and this is how we move forward together. Thank you to our allies for walking beside us, believing in our work, and helping us build a stronger, healthier Butler County. And remember, Queens, you don't have to prove your work to rest. It's just as important, it's necessary, and it's required. Your life and your work require it. We would like to end with a short message from some of our Butler County allies.
Allyship is important to Middletown because it engages the whole community. It helps the community get information and knowledge so that they can go back to their communities and educate their communities. Very important that everybody has a circle of influential people with different knowledge so that we all can be healthy and we all can have the best quality of life we can possibly have.
I have a chance where I can talk to the women and inform them and direct them to areas that they have not a clue about. Healthcare Connection, and some of the women that came in, I was able to direct them because once I get involved, I find resources. I look for resources. And as a city council person, I'm just hoping that people will gravitate towards me and will ask me questions so that I can spread what I know, resources, information, anything that they may need, or I will know where to go to get that information.
And whether Butler County realizes or not, we have a jewel, and her name is Bryn, and it's just, I can't say enough for her, about her, and the work that she does.
I'm Bryn, y'all. That's me. So thank you all for joining us today. The QR codes that you will see on the screen, or they will be linked in the description wherever this video is posted afterwards. The middle QR code for Join Our Village will get you on our email list, and the two side QR codes will get you to our Instagram and our Facebook. And one message I would like to leave you all with is our impact in public health. Even though it could be 400 people showing up, or you have 3 people show up to events, or you host maybe a clinic and you don't get a good turnout, or you host a clinic and there's 5,000 people who show up, just know that our impact happens slowly. And whether it's one person who shows up and you change their lives or connect them to a resource, or a big group, just know that the impact is far and it is wide. And the good work that we continue to do and that we do will continue to push our work forward. So thank you for joining us and have a great day.